Hi there, I'm Dr. Jill Wener. I'm a physician, a meditation and tapping instructor, and an aspiring anti-racist, which requires constant work, self-evaluation, critical self-reflection. And I am so excited to have Jamila Pleas here with me today. She is a nurse, she's an RN in labor and delivery. She has, in addition to that, which is an incredible enough job, she is the founder of Her Birthright, which is a national nursing initiative that bridges gaps in maternal health outcomes for women of color. And also she's the founder of Listen, which is another, I guess, sub-organization or offshoot of that. And so she's going to talk about that today and wherever else our conversation goes. So Jamila, thank you so much for taking time out of your day to chat with me.
Thank you, Jill, for the warm introduction and inviting me to be a part of your podcast today.
I'm so excited to have you here. And Jamila and I met, we were on a panel together talking about racial disparities in healthcare. And I just loved everything that you were talking about. So I'm so glad I kind of hunted you down a little bit and got you to come and talk with me. So thank you. So Jamila, can you talk a little bit about how you got started in nursing and labor and delivery and how race has, and systemic racism has informed your journey through your education and your bedside interactions with your patients?
So I will give you the condensed story. Before becoming a nurse, I was actually a real estate broker.
Oh, wow.
And it was after the birth of my second son, like immediately in postpartum, I made the decision that it was a good time to go to nursing school. So it was 2007. The housing market had just come like crashing down. So it was just bursting. And my postpartum nurse actually was a real estate broker that I had a pending contract with. And I just remember watching her take care of me and being in awe because I knew her as this phenomenal, high producing real estate agent. Mm-hmm. And she told me, you know, my mom told me never to give up my nursing license. So I work as a weekend nurse and it's something I enjoy, but, you know, working at Northwestern gives me the benefits that I need. And real estate is like, you know, my baby and my primary love, but I still enjoy what I'm doing here. And I only have to work like 4 times a month. And it was just in that moment, like I knew that I wanted to take care of people. I grew up with my oldest brother being in a wheelchair and I was his caregiver early on. So unfortunately, he was shot in his neck walking home from school as a teenager. Mm. And I remember going to the ER to see him for the first time and just being like in the emergency room. I was always fascinated. I would love to go to clinic appointments with my grandmother. And I remember when she had surgery, even at the like young age of 12, I wanted to pack like the wound that was healing and I would like measure it and I would make sure it didn't have a smell. Like there was always this fascination.
You're such a nurse. I love that. You were like always in there. Like I have a cousin who's a nurse and she's like, I just love the woundier, the better.
You know, it's the critical thinking skills of it. And then like critical thinking, the interaction with the families. And I'm pretty much like your cousin. Like sometimes you're just like, how can I fix this? How can I help? And I just feel like with nursing, like you see the direct impact. And I'm not sure if providers always get to experience that, unfortunately. Like, but we see the impact that we have like immediately.
I love that, yeah.
And I would say with the systemic racism, like I remember being in undergrad and originally I wanted to go into medicine. Like I wanted to be a doctor. And I was in the chemistry class and I'm going to be honest, I wasn't prepared coming from an inner city school in Chicago, high school. My high school was phenomenal. However, I didn't realize how unprepared I was until I started taking the advanced level chemistry classes.
Mm-hmm.
And I remember my professor saying, you know, you may want to try your shot at something else. You may want to try like psychology. You know, you barely passed the first exam. It's only going to get more challenging. So I just feel like that discouragement from the very onset, like tutoring wasn't offered. It was just like, hey, maybe this may not be for you.
I hear that from almost everyone I interview who is a person of color, that they had, and I interview some like really, really high performing people like you, and they've all had these experiences where their professor was like, maybe not, maybe medicine's not for you, maybe not law school. It's so amazing to me how pervasive that is and how common that is. And also that every person I spoke to still was able to continue and to persevere. I mean, you found a different career than medicine, but honestly, that's a blessing, I think, in a lot of ways. That's a whole other topic, but okay, so continue. So you had that experience with your freshman chemistry teacher.
Yeah, and so needless to say, like I passed chemistry, of course. I mean, I was so determined. I found tutors, I watched videos, like, I mean, I would wake up early in the morning to just, like, I had to, like, learn the basics, and it was, like, self-taught. But then I worked with a tutor, like, every day. I was just determined simply because he thought that I couldn't do it. It's like, okay, let me really try hard. But then I learned towards the finals that a lot of the other students had these advanced calculators, and they were pre-programmed with formulas. And I was like, okay, I should just go buy this expensive calculator too. And that was like the game changer too. Like, so something even as simple as that, like we didn't necessarily use the TI-80 calculators in high school. And so here it is, I'm failing or barely passing because I didn't even have the right tools. Mm-hmm. I'm like memorizing formulas. I'm like doing everything by hand. I just had a scientific calculator, but not like where I can, you know, plot and graph and put in formulas and just recall them when I need them. So, I mean, I would say it definitely starts with our education system, because I went to a selective enrollment high school in Chicago. I mean, a very great school, but honestly, in hindsight, it's relative because some of my friends went to a more diverse school that was selective enrollment too, but they didn't have the same struggles that I had. And they were at schools like the University of Michigan, and they were at Stanford. And it's just like, oh no, like this was a review of what I learned in high school. Wow. So you're almost set up to be behind, unfortunately. And definitely I've seen a lot in nursing at the bedside. I really didn't experience any like racism in nursing school. That was like a phenomenal experience. But working at the bedside, I saw the difference in care, honestly. So if you had, sometimes we would hear like, oh, it's a VIP patient. What's a VIP patient? We should have the same gold standard for everyone. So sometimes if administrators or some of the physicians were delivering their baby, it was like the room was cleaned twice. I remember being in one birth and the patient, a white patient, was requesting for warm towels to be laid on her perineal area because studies show that you're less likely to have like this large laceration, vaginal tearing. Oh, wow. And I was surprised that her doctor was so like accommodating. Like, you know, this doctor I think highly of, but I've never seen her exude so much patience that I was actually confused during the delivery. She's like, oh, I need warm, sterile water. And I was like, excuse me? And she's like, I need warm, sterile water. Like, I'm gonna, you know, soak towels and apply them to her perineal. But as a bedside nurse, like when the mom is getting ready to push, you really shouldn't leave outside of the laboring room. So I called the charge nurse and was like, hey, I'm in my delivery, but I need warm saline. And she was like, what are you asking for again? And I just laughed. I'm like, we need warm saline. I was like, we only have it in the OR. Can someone go and grab it for me? And she's like, oh, is everything okay in there? I was like, it's fine. But I feel like those are, it's just a small example of sometimes the difference in treatment. Of course, I've seen, when the mom is in pain and when it's an African-American mom, like sometimes the anesthesiologists are not as sensitive, not as warm with the bedside manners, or, they'll explain, but it's just that lack of compassion and like empathy.
Yeah.
And then just next door, it's like, oh, this is what we're going to do. And what are you having? Oh, it's so amazing to meet the baby today. Not as like, again, like the empathy is not always there. One case that I was really appalled by, and I actually took it to the CEO of a hospital that I was working at as a traveling nurse, is that I had a Hispanic mom. She only spoke Spanish, non-speaking English, and it was at change of shift. So I'm an AM nurse out. It was like a 7:25 delivery, and it was her fourth baby. She had delivered 3 babies vaginally, uncomplicated rather quickly, and the provider, after pushing twice, was like, oh, just call the NICU and put a vacuum on the table. So it became a vacuum assist delivery where this mom really didn't even have a fair chance at pushing. Like, she pushed only 3 times.
Yeah.
And I really just, in that moment, it's like, you sometimes can feel powerless. Like, why are we using the vacuum when she's pushing fine? We only need like a few more pushes, and I'm confident baby will come because her body's done it 3 times already.
Yeah.
But it's just that sense of urgency and, I need to get to the clinic, that in that moment the provider chose to use a vacuum. And then this poor woman who doesn't speak English, she just wants to deliver her baby. She's trusting that she's not even really aware of, some of the complications that could have happened with using the vacuum assist delivery.
And is that something that requires informed consent, using the vacuum, or is that?
Yes, it does require just like verbal consent. Like, you don't have to do a sign consent. And it was explained rather quickly. I don't think she processed like exactly what was going to happen or the complications that could result as from using the vacuum. It was just, I'm pushing, it's intense. I just want to meet my baby, and I'm trusting my doctor. This is my doctor. This is, who I've built a relationship with.
Yeah. Yeah.
And unfortunately, that's not an uncommon practice.
Right. Well, I think back to my med school days. I used to actually want to be an obstetrician, and doing deliveries. It would be me and my first year resident. I was a 3rd-year med student, and my first year, like an intern, delivering a lot of these babies, and there was not an attending around. And this was a county hospital, so it was like, okay, because it was our training hospital, But then if you were going to do it at like Emory or one of the like fancier hospitals, or I'm sure some of the private hospitals around here, that would never happen. Like, you would never just be like a med student and an intern. And so there is this sense, I look back and I'm like, whoa, you have to train, you have to be able to do stuff on your own, but like sewing up an episiotomy with just me and my intern, I didn't know what I was doing. And I'm sure she didn't know that well what she was doing. It was probably 8 months into her residency. So it is interesting how we kind of take for granted what people should and could accept and speak up for themselves. It's pretty crazy. So, how did you tell us a little bit about your her birthright? I'm sorry, and what that is, and how you got started with it. And I know that you had some live events planned that I'm assuming are not happening now. Maybe they're going.
Well, I actually was able to curate some events just online. That's been very successful. So her birthright came about after reading and experiencing actually a maternal death, right? So in the US right now, unfortunately, Black women are 2 to 3 times more likely to die from a pregnancy complication. And if you're a college educated Black woman, you're still at risk. You're 5 times more likely to experience a pregnancy complication. And so witnessing firsthand like the disparities with African American moms, mm-hmm. and then reading the data, and just I remember experiencing a Black maternal death for the first time. Like, you just never forget. And in that moment, I just realized women need to learn to speak up for themselves, and especially in the birthing process. Like, it's not a passive sport, but I believe in the past, it was just like, oh, you just go in, you have the baby, you trust your doctor, you let them just touch you and direct the plan of care, and you don't have to verbalize how you're feeling or what makes you uncomfortable, or even just your own birthing preferences. And so I trained at the University of Chicago. And at the University of Chicago, I will tell you that they're really advanced in regards to research and early detection of preeclampsia, hypertension disorders, and even in the event of an emergency, we literally have a touchscreen keypad, so you can receive help like right away.
Yeah.
But when I started to work as a traveling nurse, I realized that some of the other hospitals did not treat hypertension in Black women the same. And that was, alarming for me, because we have these statistics and we know that Black women, just being a Black woman, is one of the risk factors for developing preeclampsia. And if it's untreated, there's just a cascade of things that can happen to mom.
Can you quickly explain for people listening who aren't medical, so hypertension is high blood pressure. How does that relate to preeclampsia and eclampsia, and what, just a little bit on what that means to people?
So preeclampsia is basically just hypertensive disorder in pregnancy. But the danger with preeclampsia is that it can lead into like eclampsia, which will put mom at risk for having seizures. It can then develop into the HELP syndrome, which is meaning that mom loses the ability to really like clot her blood, like platelets. Her platelets can drop, leading to a medical emergency and result in death. So you want to identify and, early diagnosis so that you can really manage and avoid like it developing into eclampsia and then later HELP syndrome.
Okay, great. Thank you. I think that'll be helpful. Good refresher for me, because I haven't been practicing medicine for 5 years. So awesome. Okay, so you were noticing they didn't have the screening or the act. They weren't as active.
I would say that it was just very relaxed. If you had a mom to come into triage and her blood pressure was, 140 over 95, it's like it's mildly elevated. Yes, but she has symptoms of having a lingering headache, edema, swelling in the feet, right upper quadrant pain. We need to draw labs. These labs need to be drawn like immediately.
Yeah.
Or I remember in one delivery, the delivery was uncomplicated and mom's blood pressure was fine. But the moment the placenta was delivered, I'm starting to check her blood pressures every 15 minutes. The first one was like 230 over like 110. I'm like, wait, this is just wrong. So I deflate the cuff and I, readjust it. I put it back on. I take the second pressure. And again, her pressure is maybe like 200 over 90 at this point. So I tell the doctor, hey, these pressures are real. And then I started to ask questions like, Mom, have you had any headaches? Have you been having blurry vision? And she's like, oh, I was seeing spots all day yesterday. I'm like, that's not normal. And so she was an induction. I received her as a patient when it was just time for her to push. So I'm now at this point, I'm like, let me investigate. Let me go back to her labs. And her labs showed that upon admission, she had preeclampsia. And this patient was there for 48 hours with no medical treatment. And I remember the doctor looked at me and he was like, well, the baby is out. I said, yes, but we need to start her on magnesium. She can't go up to postpartum right away. She needs IV push labetalol. And so in that moment, I was just thinking, like, what about those new nurses who don't have that type of experience or who are not as comfortable, like, assisting with directing the plan of care? What could have happened to that mom? Like, that mom could have easily become one of our statistics for a failure to treat and diagnose early. I mean, upon her admission labs, it showed that she had preeclampsia.
Yeah.
But it went unnoticed until after delivery.
Wow. So what does her birthright do to, what is your organization doing to make those changes and to help raise awareness and advocacy?
So her birthright has been doing a lot of digital campaigns. I find that in the delivery room, moms are attached to their cell phone. They're on social media. And so I started just teaching, creating like chat and choose. I had one in-person event before COVID happened, and it was very successful. 65 moms of color showed up, and I had Dr. Rana, which is like one of the leading experts on preeclampsia. She came in and she spoke, but it was created not like a lecture. It was a chat and shoot. We provided lunch and we decorated the room. Like, it was more just a warm environment where women can feel safe and they can ask questions. And then the icebreaker, everyone had to write a question, like one question that you would be afraid to ask your doctor. And then we had a panel of nurses that would answer the questions. Like, how soon should I have sex after having the baby? Or is it okay to eat an edible while I'm pregnant? I mean, just like questions that you wouldn't necessarily feel safe or, embarrassed to ask your doctor. So her birthright is really focused on the awareness part and patient advocacy. I do a lot of private teaching where it's online right now, but I'm teaching in private groups and just on one, like, how to speak up. What happens if you feel ignored in your birthing process and what to expect. I'm learning that most women don't know, even as simple as like when you're scheduled for an induction, they think it's a fast process. And it's just like, no, we're forcing your body into labor. It can actually go up to 3 days if you're a first-time mom.
Wow. And
it's just like, even that, knowing going into it, this could be a 3-day process. It's like, I think it sets them up to, one, be engaged, but two, to trust the process. Because again, like with inductions, it's not trial and error, but it's a process. Like, we're forcing your body to go into labor versus spontaneous labor. I am working on right now a virtual summit for Black maternal health. It's a lot of Black providers that I'm lining up to speak. And I think this is important because in some areas, you may never encounter a Black provider. And I think it's relatability, right? We relate to people that look like us initially. And I think just the presence of being able to ask questions from a provider that's invested and look like you, so that, again, the goal is to teach patient advocacy. Like, you can speak up. What happens if you are concerned about this lingering headache and blurry vision and you don't understand your labs? It's like, how do I escalate my concerns? And if I'm being ignored by my provider, what do I do? Like, most women didn't even know, like, you can choose your provider the same way you choose your employer and your spouse. Like, you can Google, you can ask for referrals. And in early pregnancy, if you don't feel that you're being heard and the provider and, like, you and your provider just don't have good communication, you can switch providers and it can still be safe. Like, you're not married to that doctor as long as you're switching care before third trimester. And women are like, oh my gosh, I didn't know I had that option. Well, of course you do. You don't have to stay married to that provider if you don't feel that this provider is listening or is, more gentle birth friendly. You can go to another provider within your network.
I wonder also for patients who are uninsured, like I'm just thinking about the clinics that I was at, like we would be seeing someone, I'd be in the resident clinic, just like prenatal clinic, like whoever comes through is whoever you happen to see. So I'm wondering about uninsured patients. What's it like for them?
I think it's very difficult, honestly, because right now in Chicago, we're facing like a maternal desert because of COVID. A lot of the hospitals are closing the maternity wards. They were converted into COVID units. Oh, wow. And so we get a lot of unregistered patients. And I always, I try to extend more compassion and kindness because I just couldn't imagine not receiving prenatal care or walking into a hospital, going into labor, and it's this team that you've never met, but also in the demographics where you live, this is the only hospital of choice. Like, you have no other choices. Yeah. And so I try to just tell my moms, like, there's so many clinics, like you said, like if you don't have insurance, there are sliding scale fees. You need to have a prenatal appointment. You need prenatal care. You want those initial labs drawn. You want that initial ultrasound, because once you walk into labor and delivery with no labs, we don't know anything about you. Yeah. So we have to draw labs. We have to get an ultrasound, and it just delays again, like being able to treat it immediately. I recently had a mom who, she had scant prenatal care. So she had established care at a clinic. However, she wasn't comfortable with like the telehealth appointments, and appointments were pushed back. And so she just really honestly didn't follow up after like her first couple of visits. And her dating, she was unsure, but she was actually in labor preterm. And dating is very important because we need to have the NICU involved. We need to know, like, according to this ultrasound, the baby is only a little over 500 grams. Like, do you really want interventions done? Are you sure that this is the date? But in her case, it worked out well. Like, when the baby came out, clearly this baby was like a 28-weeker versus a 24-weeker. Yeah. The baby was almost 2 pounds, and the baby had great reflexes. We just, like, the room went up in cheering because the baby just weighed. And we're like, in this case, it was a better expected outcome than we had prepared for. But that's rare. Yeah. Her dating was way off. Like, this baby was a 28-weeker and baby has a battle, but we know, like, baby was looking good coming out versus a 24-weeker where it may have not been as desirable. So something as simple as that, prenatal appointments are so vital and so key. Even if it's scant, at least we can have a baseline, like, knowledge of what's going on with this mom in pregnancy. So that's going to be like an even further setback for anyone who's uninsured, which is going to be a higher percentage of Black and brown women. And then there's even worse outcomes, even for people who are super well educated. It's happening, but then this is yet another issue. And then, of course, the job loss and people losing their insurance during COVID, losing that, maybe if they did have that access to care, then losing that. So this is just such a huge public health crisis on so many levels. Tell us about Listen. What is, how does that further? So Listen, in addition to her birthright. Yeah, Listen is her birthright's first campaign that's launching this fall in October. And Listen is a framework that I developed for providers and nurses, anyone that's a part of the healthcare team taking care of women of color. And LISTEN stands for lean into cultural sensitivity. I identify your own implicit biases. S, support patient preferences. T, treat all patients with respect. E, encourage nurse advocacy. And N, normalize all birthing experiences. I believe that this framework is really, really honestly simple, but I think it's going to help us to turn the needle in the right direction when caring for moms of color. Because after researching like a lot of the headlines of Black women that's passed away, unfortunately, while giving birth, there's this common thread that there was a failure to listen. So classic example is like Serena Williams. She verbalized complaints that she was having a hard time breathing. She had an emergency C-section with her beautiful daughter, Olympia. But after the C-section, she had a hard time breathing. And initially her nurse told her, oh, it's just the pain medication I gave you. But Serena, being aware that she had a history of blood clots in her lungs previously, was relentless. No, I want a CAT scan done of my lungs because something just doesn't feel right. Like I'm having a hard time breathing despite what the monitor is saying. Like I feel it. And so finally an ultrasound was ordered of her legs. She kept saying, I'm having a hard time breathing, but an ultrasound was ordered. When that showed up nothing, then finally the CAT scan was done of her lungs, and it showed she had several small clots forming in her lungs, and the heparin drip was started. But had Serena not spoken up and been diligent about what she felt was happening with her body, someone as prominent as Serena Williams clearly money isn't an issue for her. We could have lost her. It was her awareness of her body and being able to advocate for herself from knowing her body and her previous medical history that she was able to be involved in a plan of care and to just be persistent. Like, I know something is happening. I need a CAT scan, because that was what she had before. So I always think about, what about those women who, like you said, they don't have the health literacy. They're not as in tune with their body. They don't know what test to ask for. Like, is that a part of the reason that the statistics are so disheartening? Mm-hmm. If we can just pause and really activate, listening,
I love that.
I believe that we can really just start bridging the gap and at least improve early detection for complications. I'm not sure if you're familiar with Amber Isaac. So Amber Isaac made headlines recently because she was unpleased with the prenatal care that she was receiving at a hospital in New York. And so her last tweet was, before going into labor, I can't wait to give the tell-all story about my incompetent doctors at whatever hospital. And unfortunately, she passed away from a childbirth complication. She did not live to tell the story. And this is a healthy, beautiful, I believe she was 26 years old. But she had it was like so many threads on Twitter, how she was just disappointed in the prenatal care that she was receiving. And again, she would post things like, they're just not listening to me. And so again, from reading all of this and then just my own patient experience being at the bedside, I'm like, we really have to become sensitive to listening. I think there's a thin line, with pregnancy, it's easy to say, oh, it's just pregnancy. You're going to be uncomfortable. But it's like really digging deeper and listening to what the mom is stating and presenting, the signs and symptoms that she's presenting. I don't know if you're familiar with the Kyra Johnson case as well.
I haven't followed a lot of the
cases. So Kyra Johnson her case has gone national. Her husband is doing some phenomenal work. But Kyra is an African-American woman that was affluent, extremely beautiful, jovial. She spoke 7 different languages. They chose Cedars-Sinai Hospital in California because they just wanted the best possible care. So they chose Cedars-Sinai, and Kyra was scheduled for a repeat C-section, a scheduled case, no complications were foreseen. But after the delivery of her baby, second son, via C-section, her husband started noticing that in her urinary catheter, that the urine was blood tinged. So he, told the nurse, like, hey, I'm concerned, like the urine looks blood tinged, and it was just ignored. Like, it persisted for like hours, like she was just ignored with the signs and symptoms. And so finally, 6 hours later, there was a CT scan ordered, and I think like the story goes that it was ordered stat but not performed stat. Hours later it was performed, and it showed that Kyra was having abdominal bleeding. Like there was like 3 liters of blood in her abdomen cavity after surgery. So she was rushed into a second surgery, and her husband was told, hey, this is not uncommon. You'll see her again in 15 minutes. And he reports that Kyra was like, baby, I'm just really scared. But because it was emergent, he wasn't allowed to go into the second procedure. And needless to say, like she crashed and coded and they lost her.
Oh, that's devastating.
Yeah. So there's this track record of, again, women, and especially Black women, feeling like I'm verbalizing what I'm feeling, but I'm just not being heard until it becomes extremely emergent. So I'm really passionate and excited to launch Listen. And the target is I'm already partnering with, or having discussions with providers in Pittsburgh and Florida, Maryland, and then ideally launching at the University of Chicago.
That's incredible. Congratulations. It's so exciting. All the work that you're doing. And there's so much much more public awareness of this. And this is the perfect time for you to be doing this work. It's so needed. What do you think about like doulas and midwives and like a less traditional doctor path? Because I myself obviously was a doctor, and then I left medicine and went down the meditation teacher track. And I'm 43 at this point. I'm not having kids, but I'm like, at this point, I feel like I might try to have a child in a field with I might go as untraditional as possible, but I'm say this all tongue in cheek, but obviously I'd be high risk. But I hear so much about doulas and how they're such great advocates for patients that aren't able to speak up for themselves. And I know a lot of practices are adding midwives. What's your experience with that?
So I'm an advocate of doulas. They're trained to be labor support, right? And so with the labor and delivery nurse, we're assigned more than one patient. So we try, of course, to, be there to support the patient, guide in making decisions, explaining what's happening. But with a doula, you have undivided attention. And it's like any coaching. You have someone that can really coach you along that's not a part of the medical team, so that you can really just own your own voice. And with doulas, they're taught comfort measures. And comfort measures, if you're going down the path hey, I really just want to have a natural birth, I want this natural birth experience, a doula is a must-have. Because you need someone that can help you coach you breathing through the contractions. They're very familiar and strong in knowing different positions. If labor stalls, they know different positions that can manipulate and help move the pelvis and get the cervix to start making changes. And all the research shows that if you have a doula, you're 3 to 5 times less likely to desire an epidural, because again, you have that undivided attention, someone that's well-versed in the birthing process and the physical mechanics of the birthing process, that can coach you along. I'm in favor of midwives too. I believe that their approach is much more gentle than most OB providers. They just have a real like patience and a real respect for the birthing process. You know, I'm always excited at work when I have a midwife patient, because it's just that nurse advocacy. Like when I'm communicating with a midwife, like I know that she's more likely to like listen to me and to take in my considerations. Like, hey, I think that, you know, we shouldn't start Pitocin right away on this mom. How do you feel about letting her walk for 2 hours and let's see if her body kicks in on itself? They're taught to respect the birthing process and more natural interventions. So it's rare that you would get resistance. Whereas a OB/GYN may say, oh, well, I know the baby looks great, but I'm uncomfortable with the baby being off the monitor for 2 hours. I was recently on this Zoom call for a symposium for birth equity. And I was just shocked that in the US, midwives, Black midwives only make up like 2% of the population.
A lot of room.
So, I'm sorry, I couldn't hear you, Jill.
There's a lot of room for growth there. I mean, how important do you think it is for, because I mean, I've talked about this before on these videos, but the white gaze, GAZE, white gaze is like this notion that like kind of everything in our society, it's not even a notion, it's like kind of a reality, is white is the norm, and then anything outside that is going to be the ethnic hair care, ethnic food, this kind of thing. And so white people are used to looking around and seeing most people looking like them. People of color are not. And so how important do you think that is, Jamila, you know, for you when you're a mom of 3? So like for you, I don't know if your providers were people of color or if they were white, or what that experience was like. How important do you think that is for expectant moms and families?
You know, honestly, I think that it's very important that even if your provider does not look like you, I believe that there should be someone, a part of the care team that looks like you. So with my daughter, and I won't tell my age here, but I was in college when I had her. And so I didn't know much. I didn't know to research providers. I didn't know to, you can choose a Black doctor. Like I didn't know anything. It was just like, hey, I'm going to go to this clinic that accepts my insurance, and I will have my baby at the university hospital. But the one thing that I do recall, and especially now that I work at that same hospital that I delivered her at 20 years ago, I wasn't told that the provider that I was going to receive prenatal care from, she wouldn't be the provider to deliver my baby. So it was, you know, a clinic that was government funded in the community, reputable clinic. However, the providers really don't deliver at the hospital that the moms are assigned to. And so again, fast forward 20 years, recently at work, it was a couple, and I had met them at a community engagement event, and they were disappointed that there was no Black providers on staff. And I was just like, how did you miss this? Like, I know that your provider that you received prenatal care from was an African-American nurse practitioner. However, she didn't explain that once you are admitted into labor, basically it's going to be the residents that's managing you. And that day, we just didn't have a resident of color on the floor. And it just created a huge hurdle. Like, I mean, the husband was really bothered and upset. Like, he wanted his provider to look like him.
Yeah.
And it created these barriers, and unfortunately, some emergencies happened and they refused care because it was this mistrust from the onset. And so for me, doing work in the community, it was a teachable moment. Like, as a system, how did we fail this couple? What could we have done differently? Because something so simple as knowing, like, hey, I was compliant, I got prenatal care, I loved my provider that I received prenatal care from, but not knowing that this provider wouldn't be available, or anyone from this team wouldn't be available on the big day of having the baby. And it's like, how does that happen? And we're in 2020,
right?
Like in, 1999, I remember going into labor, but I didn't care as much. I was young and I didn't have any complications, and I was already 8 centimeters. So I just want to meet the baby. I just want this whole process to be over. Yeah. It wasn't a big deal to me. But for some people who have established rapport with their providers of color, to not know that you're not actually going to be there to deliver my baby, it presented some unnecessary hurdles, and it truly affected the outcome. The outcome was not desirable, to be honest. Like, the baby had a lot of complications, and they refused a C-section because, again, they were mistrusting of the system.
Yeah.
And the baby did not live.
Oh no.
Yeah. So, I always like to walk a day in someone else's shoes when I'm interacting with the patients. Mm-hmm. And this couple, I just remember the provider saying, like, oh, well, they're just militant, and they're refusing everything, and it's almost like a cult-like practice. And it was just like, no, we're in the height of George Floyd, Ahmaud Arbery. There's so much racial tension that's been to the forefront, mm-hmm. and they actually received prenatal care. They even attended one of my community events before COVID, so they were invested in having a healthy outcome. Yeah. However, there's just so much mistrust with medicine and the African American community. They sought care from a provider that looked like them, but for whatever reason, the miscommunication with not knowing that the provider wouldn't be present at the time of birth, like, they're just like, it's all these white doctors. Yeah. Like, there's not even a Black doctor here. Yeah. And, I was just like, okay, you're correct. There's not a Black provider here, and I actually met you at the clinic event. I know that I'm confident in our team. No, there's no one that looked like you or me. However, you're not even assigned to me, but I'm invested in making sure that you feel comfortable and that you receive good care today. And this is what's going on with your baby. And he was just adamant, like, I can't trust what you guys are saying. I want a provider that looks like me. And I'm like, how do we overcome that? We didn't have a provider that looked like him.
Right. It's so hard. And I think, like, for as a white-skinned previous healthcare professional, like, instead of getting defensive and instead of being like, they don't understand how we know what's best for them, taking that moment to be like, let me find out what this is all about. Like, what has their experience been? Where might this be coming from? And not understanding this history of distrust between the Black community and the medical community. It's totally reasonable that this mistrust is there, and there becomes this, like, pointing fingers and othering, instead of just, like, taking a moment and being like, maybe there's something we could be doing differently. I think that's just such something that really needs to be that moment of, like, this is going to become a showdown. How can the healthcare professionals de-escalate that and get in the other person's shoes, like you're saying, and not have it be, like at least make an attempt and see that. I think that would help so much in so many cases.
And I think, honestly, because we're prepared to act in so many emergencies, like, that sometimes as providers, we just forget what that can feel like for the patient in that moment. Mm-hmm. For an example, for an emergency C-section, we literally have a call light. We'll hit the call light priority 1 C-section, and then it's like at least 15 people running in the room, all gowned up, to roll this mom to the OR. And it's like, we know that it's urgent and we have minutes to get the baby out, but what can we do to make every mom feel more comfortable with this situation? Right. Because it could be overwhelming And if you're already have a sense of fear because you've read all these horrible headlines, Black women are more likely to die giving birth. Black women are more likely to have a C-section. Black women are more likely to have a preterm baby. You're already scared, and it's like a level, like your defense is already up. Like, can I trust them? Are they just, are they doing what's best for me in this moment? Or are we in a rush to just like get this baby out?
And then the baby's born in that stress mode. That also, I mean, I don't know if they specifically have or can even study that, but like that cannot be good for the baby itself to be born in that like sympathetic overdrive stress moment that's already scary enough, like you're saying. Well, there is so much to think about. We are out of time, so I would love for you to share with anyone listening how they can learn more about you. If you have social media, they can follow you, and how they can get involved with Her Birthright and listen and support you, potentially make donations if it's a nonprofit. Can you share how people can pick up what you're putting down?
So my website is www.herbirthright.com, and there's definitely a donation tab, and I'm actually going to be posting some events. Also, what else do I want to tell you? Oh, IG, Instagram is Her Birthright, and also on Facebook, I have my name, Jamila Pleas, but also Her Birthright is active.
Great. All right, I'm just writing these down here. Excellent. Well, your work you're doing is so important, and unfortunately, and unfortunately, the times have brought attention to it. And thank you for doing the work that you do to support and advocate for moms who often don't have anyone else to do that, and to help people with their self-efficacy and empowering them to speak up for themselves, which is hard to do for so many reasons when you're about to deliver a baby or in the process of it. So thank you again, Jamila Pleas, a nurse, founder of Her Birthright, just doing such amazing work. Thank you so much for chatting with me today.
Thank you, Jill.